Hey everybody, this is Dr. Ben Pearl with FitFootU, and today I have, can we say with HIPAA that you are a former patient? I don't know if I should reveal that or not, but that is how we
I'm
literally met.
allowing it. I'm allowing it.
Okay, okay, that's
Yeah.
that's great. So we're already off to a good start. I have Amanda Long. She is a massage therapist, and we are going to talk about the power of touch and massage therapy. Very good topic at this point in our arc of U.S. history, world history, and everything going on with healthcare and the chaotic world. So, welcome, Amanda.
Thank you, Dr. Pearl. Dr. Pearl and I have many dual relationships. Let's just get it out there. I interviewed you for a story one time. I'm also a journalist. I'm still a journalist, but I was more of a full-time journalist before I became a full-time massage therapist. And we refer patients to one another. And we love to talk about almost everything related to bodies and feet and patient care. And Dr. Pearl and I were, I don't want to say bemoaning, but we were kind of sharing some frustrations we have about how when you try to do a lot of things for a patient and they still, or a client in my case, and they still leave feeling unheard or frustrated. And so he was telling me about a patient who had plantar fasciitis, a common, I think that was right. Was that right? Was it plantar fasciitis?
Yeah.
Which all of us see all the time. Oh, that's my dog. She feels that's how we all feel about plantar fasciitis.
Barking feet, right?
Barking feet. My dogs are barking. Laser. It's enough. Okay. Anywho, I wish we could do that for PF. Stop. Um, so Dr. Pearl was talking about all the things he had done for this patient, showed her some YouTube videos, probably did some imaging of some sort, showed her some orthotics, some interventions, all the kinds of things, because he knows a lot. He is someone with a lot of tools at his disposal. And I, being the massage therapist in the room, said, well, did you touch her where it hurts? Did you touch her foot where it hurt? Did you start like treating a little bit and saying, is this where it is? And because I know in my own experience, having gone to some orthopedists before, while I'm just sitting there in pain, they don't ever touch it. They don't ever even approach the area that I'm talking about, where I have all this emotional and physical pain kind of wound up and all these questions about it. And I just want someone in a respectful way, which we have as clinicians. We have a clinical approach to touching. We should be using our hands as information seekers. And I think my little soapbox is that too many clinicians aren't doing that. They just aren't touching people. And I get the fears about inappropriate touching. Of course I do. I'm a massage therapist. It's a huge risk in my profession. And if people think that is the kind of massage therapist I am, it puts me at risk as well. So of course there has to be boundary setting. But if someone is coming into your office and saying it hurts here, it hurts on my feet, I think we do them and us a disservice by not feeling it, because that gives us so much information, and it starts to do a wonder for that patient. Their nervous system is calmed. I think studies show the power of touch both ways. There is definitely, people know that being touched inappropriately is just as powerful as being touched appropriately. But we can get to the actual studies. There's been studies about babies in Russian orphanages who failed to thrive because they weren't touched. There's been more recent studies about NBA players who smack each other on the
Yeah.
butt.
I want to drill down to those studies, but I wanted to share something with you with that experience is that when you don't do almost more connected touching as you're doing the touch. So even though, like, let's say this was not a good experience for this particular patient, this scenario I gave you, they'll go to a platform on the social media and say, oh, Yelp it up and say, oh, the doctor didn't even touch me, even though I know for a fact that I measured her equinus, the fact that she didn't have a lot of ankle range of motion. I didn't do a more kind of nuanced and longer period of a kind of reassurance touch where the area of pain was,
Yes.
because there was a lot to explain. And that was another thing we were talking about. But in their Reader's Digest of the thing, they edit out the fact that they were even touched at all sometimes. And in some instances, there are cases, I know myself, I can't claim that I've, previous to sort of dialing in with this thought process, that I haven't necessarily touched the patient. It might be a lesion that could be
Yeah,
precancerous or
of course.
something like that, where
It could be
it is
fungus.
sort of, it
You
is
deal
what
with
it is.
fungal infections. Yeah,
Right,
yeah,
right. Do I need to touch the nail to affirm that?
yeah.
Correct. So, but it is very important. And you mentioned, and well, let's just say I want to just share one more anecdote, and then I want to hear about some of the studies. The one anecdote that I will say is that I was recently on a flight back from vacation. I was on a flight from Denver, coming back to DC, and a former nurse was having a panic attack. And so they asked for medical volunteers. It was me, a nurse, and an EMT. And I noticed the EMT was literally holding her hands as she was relating, and it triggered back to a trigger that she had had with a family member, etc. And it had happened while she was flying previously many years ago. And so, at any rate, I kind of took that cue, and I just put my hand on her shoulder, and it was amazing. The blood pressure was going down. She was becoming less dyspepsia. She actually had a medication that the EMT advised that caused a little bit of dizziness. So,
Oh.
and what I would say for that moment, the touch seemed to be more powerful than the medication, and it didn't have the side effect. So I just wanted to sort of blurt that out. So yeah, yeah. Tell me a
Um,
little bit about some of the work that you've seen, though, research
well,
wise.
a few years ago, I did a couples, a partner massage class. I didn't have to be couples. I didn't want it to be that, rose petals and all that stuff. But I wanted to really give people who are coming to this a more grounded clinical foundation for this power of touch thing. And so the first one I had read, and I'm not going to be able to call it up, and anybody who Googles this will find it immediately, is a very well cited. The book I immediately brought into the class. Well, I'll tell everybody now. It's called Touch. That's the name of it. And The Science of the Hand, Heart, and Mind. And it's by David J. Linden. And that book is full of research about the power of touch, going back decades. I mean, I think the first one was, I think it was in the early 1900s, this Russian orphanage thing. It really showed about like mental acuity, like their brains didn't it talks about, in that same book, it talks about animals, like how cats lick each other and stuff like that, their babies, as a power of touch. Puppies learn proprioception from touch. So much of this is such a huge sense that we have, that we I think in this world, this very virtual world we live in. I do this a lot when I'm talking to people. I'm a very talkative person with my hands, obviously. Then there have been more recent studies, and I can cite them if I can look them up on PubMed without losing everybody's attention, that were done specifically with athletic performance in mind. I think somebody, it was anecdotal. They saw people, it was a German professor who was at Indiana, our alma mater, and Purdue, where if you live in the Midwest, you know that basketball is religion. And he knew that this is something he could study. So he studied the effect of touch on players, and it did improve their performance, mostly because it promotes a sense of camaraderie and community. But I mean,
Yeah, and there was another
go ahead.
piggyback study to that with NBA players where they looked at season performance, and the robustness of the study wasn't huge, but there was a measurable difference in a trend. So a lot
Yeah,
of times a study will finish with this suggests, but more research is
it's
needed.
needed.
But what you would see is particularly amongst the leaders, let's say it's a LeBron, where because of how fast everything is going with athletics, there's not always a chance to talk it out. So
Exactly.
it might just be a fist pump. It might just be like a pat on the back, whatever. And
But
that
it's
is,
not, but it's an I
yeah,
see you. I'm here for you. It's an immediate, like,
I got your back.
I got your
Yeah,
back, right? I
yeah.
just was reading something else. I mean, it's not even, you don't even have to be an athlete. I was just reading another study. It was from 1976, in which library, this is insane. I love this. Hold on. It says they measured how, like, when people return their library books, if the librarian like physically touched their hand and then they followed up with them, people who had their hand, this was in Psychology Today. This was an article from Psychology Today. People who had their hand touched reported a more positive experience at this library. Now, this is not a blanket permission slip to just go out and start manhandling the world. Of course it isn't. Nuance is really what separates good practitioners from bad practitioners, right? And anybody who's been to and had a bad massage, I mean, I count myself or a bad experience as at a doctor's office or a bad experience at a stretch lab or all these places that are popping up. I feel to fill this void, which I think has been created by a very online world. People don't go into the office anymore. They don't sit around each other when
sure, we had 3 years of desensitization with the pandemic.
Yes. Where touch was actually something that we were afraid of. It with good reason, because we thought it was going to kill us, right? But being in personal, close proximity with somebody was terrifying. But I think it did a number on us. And I think I think that's going to be the research that comes out. They're already showing like kids don't know how to talk as well because they couldn't watch mouths happen. But I remember, I mean, I'm not at all dishonoring anybody's history by telling this. I have a lot of people who come to me and will say, you're the only person who touches me. I have a lot of women who are over 50, a lot of men, their husbands.
So let's drill down a minute. And you already gave one clear thing that to explain what you're doing almost as a tacit permission that, hey, I'm gonna, and I do this too, like if I'm measuring hip areas and looking for symmetry, I let the person know, hey, I'm going to assess your pelvic obliquity. I'm gonna, and so let them know as I'm doing it. So almost to give them a heads up so you're not startling the patient. But what are some other cues that we can do or other things that you notice in your field and that you would recommend to other healthcare practitioners to not literally be, quote, ham-fisted about it?
Right. A lot of times when we talked about this before we started, but a lot of times even before I put my hand on them, I just listen. You know, you have to, and I'll say when people come in, I'll be like, so I'm the kind of practitioner who likes to take time to do a thorough intake, which means listening, talking, and touching you before the actual massage starts. And you know, if they kind of look at me blankly, I'll be like, you know, I'm going to need to like do some assessment to just see where things are on you. If one hip is higher than the other, I'll try not to use any words. And I know it's hard for us, like obliquity or whatever. But I'll make sure that I'll slow it down. I think that's a really hard thing for all of us to do, but I will try to slow down my pace in talking. I will often sit down so they sit down, and then we'll get up if we have to do some range of motion testing, but just so I can look them in the eye, because if not, then they're like taking off their clothes and they're putting things up, you know, so first I establish a connection just by listening, right? And that doesn't have to take a long time, because that's when they're going to start saying, you know, they might even start moving around. You know, I notice when I do this, it hurts. The other thing I will do to get them more, this is, I think, huge. We think about bodies all the time. Most people only think about their bodies when they hurt. You know, nobody's walking around with knowledge of the piriformis unless they have piriformis, a pain in their ass, right? So once they start talking about where it hurts, I'll let that lead to be like, okay, can I come over here? Can you show me? You show me where it hurts. I mean, all of us like to be like, I know where that is. Let me show you. I know exactly where it is and show off. That's fine. We can do that when we start treating, but I will ask them exactly where it hurts, because often we'll find like it's not their piriformis, it's their glute med or whatever, you know, they got Dr. Googled it, and that's fine, because half of pain is not knowing what it is or when it's going to end. That's stressful. So then that's when I'll be like, here, can you, and then I'll ask them to move, right? What movement makes it happen? So really, I think that is being next to them. I'll often move with them. You know, I'll sit down with them and be like, so bring your toe up towards your shin, because I can't say dorsiflex to people. I just can't say that. I will eventually say that, but I find when people are in pain, they're already of course, they're already stressed. They're already up to here. And if I start filling them up with more stuff, it's going to overwhelm them, because at some point they are just going to want me to touch them. So that's when I'll be like, okay, so when you lift your foot up, does it hurt there? Does it hurt here? That it's a little more.
I just want to interject something to piggyback on what you just said.
Yeah, please.
And we talked about this, and hopefully this doesn't occur at your clinic, but we have a new pavilion at Virginia Hospital Center So there might already be confusion just getting to your office. So now they're running 15 minutes
Yes.
late. They got to pick up their kid.
Oh, yeah.
They didn't realize that there's no parking validation. And so all these things. And so all it takes is now you're trying to collect a copay when they didn't realize they're out of here, you know? So it's like
there's so many
there's a lot. And we used to talk about this when we were doing hospitality training with the ski mountain. I used to teach up at Whitetail. And that's in fact one of the articles that you did is a side gig that it was, I guess, called First Person that the Washington Post did, that you would have this side gig that you did in addition to your normal day-to-day job. But that enforced to me, and you know, sometimes I don't always execute it as well as I would like, both by having the right team. You know, medicine is very much a team, but having someone come to the mountain for a ski lesson with their child, all the frustrations of getting the boots, the rentals, the being late, the kid not wanting to get up or them not wanting to get up. And then you're there at that moment. It doesn't take much to set them off, to throw the skis down and I'm out of here. And it's the same thing in our medical offices.
It totally is. And that is, I think, having that kind of knowledge that people, I always say this. I used to say it when I worked at 3 different places in my practice. I worked in a hospital setting, at a clinic in the same hospital where you practice at Virginia Hospital Center. I worked for the Teal Center and we had a practice in there. People would, as soon as I pulled into that office, I would get in the parking garage and I would be like, anybody in here could be your patient. That do not honk, do not get frustrated. You don't have any idea what these people have just heard, who they're going to visit, what they found out from that doctor. You have no idea. Nothing makes you more, I hope it made me this way. And I try to think of it more in tune with the fact that you don't know what other people are going through than being in a hospital parking garage. You will also be frustrated out of your mind because they're never well managed, right? So I would be frustrated too, but I would tell my clients, and this is something that I used to roll my eyes at when they would tell us this in massage school, but it works. I would say, you can be, all those stressors will be waiting for you if you want them to after this session. All of that, we could put those right outside this door and you can still be pissed off about your copay and how bad the parking was, all that, or who the president is. This has happened. We live in DC. People would come in hot about that, you know. I'm like, but the great thing about this room is it doesn't have to be in here with us. This is literally a safe space for us to be, where your pain and helping you get out of it is really the only thing that matters. And I know those things piss me off too. I don't like parking. I don't like paying to park. I don't like being frustrated about getting in here. I don't like any of those things either. So I'm kind of with you on that. You know, I'm not against you, but in here, it's you and me against this pain, or, you know, or for this relaxation or whatever. And that normally I'll see some eye rolls, you know, but a lot of people will laugh or they'll say, all right, you know, and I, you know, and it happens to me too. But, and I think both of us need to be aware of this. We do have to let that release valve happen a little bit. They need to come in and go, they need to get it out a little bit, because if not, they'll feel like you're not listening to them. You're one more person who, like, they're like, oh, I can't believe I have a copay. Yep, that's true. We can talk about that later, but let's focus on your foot now. Let's get to all that, you know, because we have a limited amount of time, even I do. And I really want you to come out of here feeling like you got some treatment. And you, I hope you do it too. And I think a big part of our job, and I don't think a lot of massage therapists do it, I know they don't, is level setting, like saying, I don't think we're going to solve all this in one session. Which, I mean, I've had, you know, clients say to me, and they're always, I have to say, these are the clients that give me the most angina, who are like, you fixed me. I'm like, no, like somebody loosened that pickle jar before you got here. It was just lucky timing, or nobody had ever touched your sacrum before in your life, and that's exactly where it hurt, you know. But they'll be like, it never came back. I mean, that happens every so often, but it's a high bar to set, you know. And when those clients come back with something else, I'll have to remind
more often than not, it's just waiting for the next incident to precipitate until they've had a full managed program, which includes their own homework, right?
Right.
The exercises they need to do, which I'm sure you review as well.
Yeah, that woman had sat on had driven from like Duck, you know, and she's 75 years old and her butt was on fire, you know. And,
Yeah.
of course, it's because she always stands with that leg out. She's a
Yeah.
ballerina. There was a lot of things happening, but I got it out of the acute. I put out the acute fire, and she's been a client for 12 years, and we keep that fire abated. But
So
I think,
let me try to summarize, because there's a couple other hot topics that that are out and about in your space. So let's just say that establish an early connection with touch, which includes verbal, tacit sort of consent, so that they're aware of what's going on, mirroring their body language, getting down to their level, honing in on the painful area.
Yes.
And then you mentioned a couple other key points, that understanding of what all the baggage that they brought and creating that safe space. I think that's most of what you're talking about, and how transformative that can be for the total patient experience.
I tend to have, yes, and I tend to have a firm touch, which is why people like me, like my treatment. But I also have to really watch out, and I think this is what I wish more doctors would do. If somebody is coming in a lot of pain, you have to really lighten up your touch, right? Even like getting on an x-ray machine sometimes can feel like, like, you want me to put my foot that I just told you hurt, like on there, that hurts or whatever, So I will, I think, just to myself,
gauging the level of intensity.
Like not just level setting on expectations, but like, how much does this hurt, and how do I not want to come in? Because you'll see people like flinch. The other thing I try to always do, and I normally only fail if it's somebody who's a regular, is asking them, is there any place you don't like to be touched? I will just say, are there any places you don't like to be touched? I mean, and you can't assume. You just can't. You don't know any.
Part of establishing the safe space.
This is your body.
Yeah. I want to get, because we're in the home stretch.
Okay.
And that is the next topic. That just came to mind. It wasn't pre-planned. The Stretch Lab. Tell us. So there's a lot of franchises popping up, and we're not here to badmouth, but the good, bad, and the ugly of a franchise like Stretch Lab. You've been to them. Yeah.
Yep. I think it's the same as any other a massage place, a yoga studio, any other place that sets out to treat people's pain, to have people working one-on-one with somebody else in their body. It is a huge, I'm gonna sound like an asshole. It's a huge honor and a privilege to touch another person. It really is. And I don't know if that is being stressed enough in how quickly the rollout of these places are happening. And it's hard to do, right? You train people for 200 hours. You give them the full, that's how many, I took a assisted, what's it called? Assisted isolated stretching class, PNF, whatever you want to call it. I've taken these classes too. And I'm often left at the end going, but how do you talk to people about how you're going to do this? Why are you telling them to do this? So what I'm trying to say is it's consistent in the fact that it depends on who you get. That's what I'm trying to say. If you show up there, the first time I showed up at a stretch lab, I was drinking the Kool-Aid. You texted me that day and you're like, let's talk about this. I'm like, oh, I'd love to talk about it. I'm about to leave them a Yelp review, because the person, they call them flexologist. The flexologist that I had was like 20 years as a dancer. So lots of body awareness herself, lots of cueing. She knows how to cue. She knows how to get other people to move their bodies in the right way, right? And she's been a personal trainer. So underscoring that too, training. And she had 2 decades of touching people. It is nerve-wracking for the first time to just put your hands on people, whether they have clothes on or not. I don't care. Then on top of that, there is a language disconnect. The last time I was there, this client kept saying, tell me when you want me to stop pushing. She was not pushing. She was pulling. There's no other way to describe it just was a thing. And I kind of laughed about it. I'm like, oh, that's funny that you call that pushing, because I really feel like you're pulling my leg. It just went, she had no idea.
Just to clarify though, Amanda, that first experience with the dancer, were all those things, those were attributes. So that was
amazing.
Good.
It felt like
then the consistency depending on who you got.
Yes.
I would go out on a limb and say that in any field you can have outliers, but I know that with your training, the number of hours that you have to do with
Oh
your
yeah.
training versus I don't know if you
Oh yeah.
described the stretch lab as a crash course, but it's certainly less hours of
Oh,
training than you've had.
it's definitely less hours. But even I had 600 hours of training to graduate. And then I was in a and then I immediately didn't think I had enough. I was still nervous. I mean, I knew I had to get a job, but I was like, how do I do this? How do I just walk into an office and be like, hi? So I did a fellowship at another practice at the Teal Center, where I had another 8 weeks of I was working and seeing clients, but I was also getting trained once a week on different parts of the body and neuromuscular therapy. And then I taught that fellowship because I think it's essential to get that kind of incubation when you're first. And what that ended up being is, yes, we would talk about this is where your SCM is, and these are the trigger points, but also a lot about how to talk to a client about how they feel. And I think that's what's missing at places like this. They know that there's a huge demand for people who are in pain and who are working out a lot. And there's a lot more awareness about, I mean, there's an Instagram reel for every single thing, right?
Yeah.
Your hammies hurt, your glutes hurt, psoas is the source of all your trauma. All of it is being dumbed down to these reels, right? So why certainly a 25-minute or a 50-minute stretch is better than that, but it has to come like every single place. Massage, podiatry, stretch, yoga. There'll be all kinds of these cold plunges.
Right. And I think what you're getting at with these reels is it's not the whole comprehensive plan per se. It's like you're going to the menu at McDonald's and you're ordering the fries. Right. And you may need, the balanced diet. So you touched on something else, and I'm glad you brought up neuromuscular, because that was the last hot topic I wanted to wrap this up with. So we've all seen Sanjay Gupta, and anytime he says anything, it's like, well, this thing has been around a lot, but just because he said that now there's this connection between the feet and
everything else,
dementia, and how the proprioception to the feet can be important for your overall health. Now everybody's like, okay, this is now the gospel. But maybe you can talk a little bit about where you think the rubber literally meets the road with this new neuroscience, foot, body, mind sort of connection. And obviously we had talked about the Chinese have been doing this with years with their reflexology and so forth, which is a whole nother topic. So we maybe just dip into it a little bit, but maybe give sort of just your overall on this movement and where you think people can dial into it.
Well, for when I first learned about neuromuscular therapy, I just thought it was talking about like, well, these are the nerves in the body and these are the muscles that they tell what to do, right? Your sciatic nerve goes down your leg. This is where they are. This is what they do. This is where they start in your spine or whatever, or in your spine. And then they go out, and these are the muscles that they innervate. These are their connections. So if you have weakness, more of that really like physiological connection. Am I making sense? Just like these are like geography. These are where these nerves are. These are the things that they innervate and make move, and this is how you treat them, right? And also there, so more of like don't land on a nerve and just press on it, because that's going to irritate it. So a lot of that. But the more and more that I have done this and that have felt it myself, and reflexology is such a part of this. And I don't know if Gupta talked about this. I'm sorry to say, I don't know that, but it's more about making that connection with your brain, your neurological connection, and because there's no disconnect. It's more about reinforcing that connection. Like, oh, that is my external rotator of my shoulder. I never knew that. Literally creating a pathway in your brain that's already there, but reinforcing it, thinking about it. I have a great Pilates instructor, and she had t-shirts made up that said, squeeze your butt with your brain, because she wanted people to literally be going, and this is, I've gone to some classes about that. This is a lot about visualization, literally picturing which part of your body you are moving and engaging and feeling when you do it. Or when I'm on your foot and I'm saying, do you feel that anywhere else? Maybe they don't, because maybe they haven't laid that groundwork yet, right? But I feel like more and more of neuromuscular therapy is helping people reconnect with those pathways that are already laid there. through our neurological system, which is our body's messenger. That is its whole job, right? Is communication. Like I mean, right?
And they talk about neural flossing as
Yeah.
well.
Yeah.
The
So
importance
that's
of the full nerve connection from literally head to toe.
head to toe, right? You have these strings in you that get bound up. I mean, the body is as
With
magical as,
fascia and scar tissue, right?
yeah, it's also just a pile of stuff, right? We're magical beings, but we're also layers of things, flesh and skin and fat and fascia and muscles and nerves going through all of that. And flossing is just a fancy way of saying, making sure you feel that entire connection. And you do have to think about it when you're doing it. And because again, you and I are people who think about this stuff all the time, but most people don't think like when they're walking, oh, I'm doing shoulder flexion and shoulder extension and, hip
Right.
flexion. No one is thinking like that. But I think, and I know because I feel like that's what neuromuscular therapy is. What I do is helping reinforce that connection, because a lot of injury happens when there's a disconnect there, right? Everybody can bend over, but if you're not thinking about which muscles you need to use and engage, you don't have to really think about them. But if you're not if you're not aware of what you need to like walk through that entire gait or do that, you tend to use
Right.
muscles of redundant. Luckily, we have a lot of muscles of redundancy, right? That's the other magical thing about the body. Not many, no one, I can't think, I know there's some like extension of the knee and extension of the elbow where there's
Right.
just one muscle that does it. But most actions have more than one muscle to do them, right? And so if one is weak, we just use the other ones over and over. Like, if you want to get your arm above your head, you can just do that. And then your back's going to hurt, right? So making that connection, going, no, this is what it feels like. Oh, that's what it feels like. A lot of the work that I do is I'll tell clients, we might have to talk during this session. Hopefully we'll get to a point where we're just kind of talking without talking. I'm feeling things, you're feeling them. It's like I'm reading your mind and I'm reading your body, but often I'm going to want you to be like, oh, I feel that. Yeah. So, turn your wrist. You feel that in your shoulder? Yes, that's the muscle.
I want to harp on one thing though that you mentioned that I think is so
Sure.
critical to this whole podcast, which is that when you get those more efficient neural connections and body awareness, then we're unginking all the patterns that create the pain.
Right.
Because now we've done a more efficient movement
Yes,
pattern.
inside out. It's from the inside out. It's from the nerves out. Yes, we can show them all these exercises, but if you don't know why you're doing that exercise, or you don't get why it's important for you to be able to bring your toe up toward your shin, right? Well, when you walk, you need to step through that. You're unkinking a pattern. I mean, I feel like that's mostly what I do.
And it applies to the mental as well, which is
Of course
why
it does.
people
You have a
do
pattern
get
up here.
sure.
Yeah.
When we have triggers, we've had these. There's a
fall
condition
right
called
into
reflex
that.
sympathetic dystrophy or causalgia, where
Yes.
there's a reinforced
There's a
pain
reinforcement.
pattern.
Right.
Yeah.
And when something hurts, your body tells you not, what's that called? Neural inhibition, right? When something hurts, you will not use it, right? But then that can overtake it. And even when it's better, you still won't do it until you learn to carve that pathway again, right? You'll be fearful of it. You're like, well, it hurts when I do that, so you won't do it. But actually, I mean, I'm the perfect example of this. I broke my leg 29 years ago in a bicycling accident. It went through my butt and came through my hip. I had no hip muscles and it hurt. And so I kept telling myself, well, I can't use that. So I didn't because it hurt. And now I'm like, no, you actually have a butt muscle. You can use it. You have hip flexors. You have a glute med. But I have to think about using them, because if not, I'll start standing in a certain way that like takes all my weight off of it. Or, because those patterns are deep. Those ruts get really deep. But the good news is,
so use it or lose it, right, Amanda?
right, we can dig new we can dig new pathways, and that's and touch does that for people. It helps people get that connection if they're not already having it, or they're not aware that that's what's going on. Sometimes touch can be a huge part of that. I have a teacher who always talks about when she's working on a patient, she'll be like, okay, now I want you to move. Now, do you feel you feel the precipitator of that move? Okay, now try doing it without that. So people will feel distinction. So I just think,
Yeah, no, this has been great, Amanda. Thank you
yeah,
so
you're
much for
welcome.
doing this podcast. So how can people and
Find
Amanda
me.
does have a very busy roster, but if they want to reach out to you, how would they
You could just, it's really easy. My website is my name is Amanda Long, and my website is alongmassage.com. alongmassage.com. Who doesn't want a long massage? And my email is on there. There's plenty of ways to get in touch with me. My phone number is on there, but it's alongmassage.com. No www. Just, yeah, a long massage.
Well,
That's how you
thanks,
find me.
Amanda, for doing today's podcast with
You're very
Bigfoot
welcome.
You.
I'm
It's been
glad
a
we
long
made
time
it
coming.
happen.
Yeah.
Yeah. All right.
All right.
Thank you.
Keep on healing.
You too. You too. Touch people. Not
I
with
will.
permission.
I will. Okay.